Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Today's topic, the theme, again, has to do with diabetes. iCON is, the office is situated on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. iCON is an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural the public to know more about prevention of diseases, and also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health. So for the time being, let's hear from Dr. Tigerson Young about the psychological health factors associated with diabetes. Okay, it's all yours. Thank you. Thank you. How's everyone? I'm Tigerson Young, Dr. Tigerson Young. So thank you, iCON, for inviting me this year again to share my input with you. I really appreciate Doctor's introduction. Actually, every year to be able to participate in iCON's fora is a very great honor. So we will talk about lots of things, about lots of information about diabetes, especially affecting your physical health. And today is no exception. Other than myself, you will hear from other speakers on information about diabetes. I'm going to try to take it from another perspective, from another facet to look at diabetes. The most important responsibility for me today is to look at it from a psychological angle, how diabetes affects us. We've mentioned just now that, so let's go to the next slide. Let's look at it from a few different perspectives. Barbara has mentioned that economically, it has some impact on us, meaning diabetes has impact on us. So how about within the Chinese community? How much impact does it have? So let's have a look at how much psychological impact it has on us, and in the end, how we can face it, because there are other issues such as emotional mood issues, how we can deal with them. So first of all, let's look at how prevalent is diabetes, or how prevalent diabetes is in Asia. So we have statistics from recent research. So there's about 500 million who suffered diabetes as of last year, and we don't count the children yet. So there are, in other words, it affects 20 to 79 years. People who are 20 to 79 years of, it's like 500 million of them. So there will be 600 million in another 10 years or so. So you can imagine the people who are affected is so numerous. At the beginning of this year, there's a research at the United States from the CDC. They wanted to look at how many people in the United States of America suffered from diabetes. As they found out that 1 in 10 people have diabetes. 1 in 10 people has diabetes. So how about Chinese? Let's have a look at, because we want to address this issue in Canada. So in Canada, there's about 38 million in population, and the Chinese in Canada, there's about 1.8 million, which is about 5% of the total population in Canada. If you look at BC alone, in BC, there's 5.2 million in population, and the Chinese in BC, there's 600,000, which is about 12% of the population in BC. So there are a lot of Chinese who are living here in BC. So let's assume, let us estimate that, okay, Canadians are healthier than Americans. So about 8% instead of 10% of people who have diabetes. So if that's a conservative estimate, so within BC alone, among the Chinese alone, there may be about 144,000 people who have different types of, 48,000 people who have different types of diabetes. Other than these numerical indices, there's another tendency that we have discovered. The new cases, the growth of new cases have increased very rapidly. There's a study from UT in 1996, among every 1,000 Chinese, there was a 1.3 new cases. That was in 1996, but in 2005, there's like a 15 times increase to 19.6 new cases among 1,000 Chinese. So if you can look at the more recent research, you will see that the rise has been even greater. So why do we have to understand these figures? Because actually, it's closely associated with our mental health, diabetes. So among those who have diabetes, about 41%, think of it, it's about half of them will have different types of mood issues, psychological issues. And there's another tendency, only 9%, less than 10%, if they have mood issues, they will be referred to psychological treatment. So about 90% of those who have diabetes, they have not had a chance to be referred to that. So you can imagine how large a population that is. So diabetes is described as one of the chronic diseases that can affect or have more demand on our behavior and mental thinking. So just think what we have to watch out for if we have diabetes, about eating, our diet, our treatment, our medications, booking our finger. So all of a sudden, so many things that we have to do. So you can imagine how much stress it creates on us physically and mentally. So you can understand, you can appreciate. There's research that shows us that diabetes is closely associated with some mental disorders. For example, depression, insomnia, anxiety, eating disorders, and etc., schizophrenia. So it's about between twice and 3 times as much as normal people who don't have diabetes. So we cannot neglect the impact diabetes has on our mental well-being. So the next question, how can we cope with these obstacles, these stresses then? So do you want to know? Well, I have a suggestion. Maybe this can help you control what the stress created by diabetes. So let's give you this tip. Retirement, right? I'm sorry to talk about. Oh, actually, no, Dr. Leung is trying to trick the interpreter. It's not retirement. It is about no worries. Try not to worry. So by retire, it means it actually is an acronym of 6 letters. RETIRE, because I wanted to retire, but we're not talking about retirement, we're talking about an acronym. So let's talk about what these letters stand for, RETIRE. So it's not retire, but it's actually less worries. So let's see if we can deal with diabetes if we use these 6 techniques to manage our stress, okay? Okay, retire. Number 1, the first R is reframe. So reframe meaning reorganize our thoughts. What does it mean? So for example, sometimes after we have this condition, then we paint ourselves in the corner. So we have put ourselves into a trap collectively in terms of our thought, and it's no snowballs. For example, interest rates are snowballing. So if you want to have less worry, and what do you have to do? You have to, okay, let's reduce the color here. There's a black and white color. So instead of looking at things from either extremes, whether it's black and white, so look at it. Let's take the middle path. So don't look at it from the worst case scenario. But that's in a culture. In culture, we tend to be more pessimistic. So remember when you were a child, and if you didn't get 100 marks in your test, your mom and dad would say, "Oh, you must have been lazy." So that's how our thinking, that's how we've been brought up. So if you want to control our stress, what can you do? You can reorganize your thoughts. Okay, the second technique is how about examining our facts, re-examine the facts. Now, whenever we make any decision, can we first, okay, collect some data, some evidence, some facts? Start with that. Can we learn not just to jump into a conclusion out of a whim from our emotions like fear, anxiety, and all that? So instead of knee-jerk reaction, we can look at the facts and before we behave anything. So does it mean that if we are in a depressed mood, we have to give up everything? No, it doesn't mean that. If you are in a depressed mood, that is mood. So whether you give up, whether you can do that or not, it's a behavior. You can decide on whether you can do it, how you can behave, and then you can jump into conclusion. That's so simple. So when we make decisions, what do we rely on? Common sense. We have to rely on common sense. We need to use logic to analyze whether such behavior, such decision, what are the advantages, what are the disadvantages, what will I gain, what will I lose? That's how you make decisions. It's not because of knee-jerk reaction impulse. So you can try whether you can re-examine those facts. The third technique is take a detour. Now, how do you take a detour? Simply put, so focus on those things that you can control, especially if you have some information about diabetes. Sometimes you will focus on things that you cannot control, right? So really, yesterday, whatever you did yesterday is a fait accompli. You cannot change it. So you cannot control lots of things that happen around the world. So why don't you use energy and focus on the present and what you can do, what in terms of behavior, what you can change, and what are the results, what are the outcomes that can be more effective. Okay, the fourth technique, I'm going fast, right? So inform. What? Recalculate your fears. Okay, so I'm sure that the stress when you have stress, well, even you won the 649 jackpot, you still have stress, right? The good news is that such stress is not to be shouldered by one person. So you can share that with your family, with your friends, share the stress. Maybe sometimes you can talk to somebody about what you think inside in your heart. So maybe you cannot change the facts. At least you can face the reality, the stress that's created by this disorder. So how about, but people say that I don't want to spread negative energy to my friends or energy because they are already stressed enough. So, okay, even though you don't have someone to talk to, you can write it down, write a journal, record on your cell phone, right? So you can have an outlet for your moods, for your frustrations, for your sentiments. So that will reduce your stress, right? So the fifth one is what we can do, recalculate. Does it mean that whatever we fear is things that are so risky as we have thought? Not necessarily. Why don't we try to use another way to ask questions? If you were to ask me, hey, Dr. Young, will there be will terrible things happen? Well, my answer is for sure, it's possible. You know why? Because everything is possible. You know, Lotto Max, those things, what do they call in the United States? Those jackpots, they're difficult to win. It's improbable, but it's still probable. It's still possible because the only answer is everything is possible. So what can we do then? Change your way of asking questions. Let's try to ask questions like this. So if those terrible things were to happen, what are the possibilities? So for example, there are side effects for taking injections or medications. If you were to ask me, will there be side effects? I said, yeah, of course it's possible. Anything is possible. Anything. So for me, actually, the right question to ask, what is the probability? So it all depends on the risk factors. So everyone has different risks that they face. So that's how you make decisions. For example, if I take a flu shot for the last 10 years, I've had allergies to that. So we know that. So there are risks involved with taking flu shots. So you will decide whether the effect is greater or can offset the risks. So the good news is what the risks that we imagine may not be factual risks. So the last technique is we have to evaluate starting from the 1% rule. Say if you want to eat healthily tomorrow, do exercises starting tomorrow, wake up early, go to bed early, to be a happy person, maybe I won't be able to do that. But can you start with 5 minutes of exercise every day and then add 1 minute every day? So by the 6th day, you can do it for 10 minutes. So if you do it gradually, one step at a time, 1% increment every day. So cumulatively, it will become a lot more. So if you can try this new retire 1%, okay, less worries, the 6th technique. So even worse comes to worse, you cannot change your diabetes, but at least you won't be facing new obstacles for having diabetes, especially mood obstacles. Like I said before, diabetes and our mental blocks are closely associated. If at least you can remove or control that block, even though if you cannot control diabetes, you can still, you win half of the battle, right? So as a caregiver then, what can you do? Well, first, you can learn more information about diabetes, for example, today and yesterday. So when you learn more information about this, then you will have less fear about diabetes. So the fear is reduced. The second thing is to try to talk to the patients more. Like I said before, sometimes the patient feels, okay, I want to block everything away. I don't want anyone to be impacted. So they don't take the initiative to talk to you, to talk about their stress. So we can try, when we care for them, talk to them more. And then when we talk, well, there are techniques to do that. So we have to know how to listen, and not just, oh, you can blah, 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 and solve their problems. No, although, yes, you can solve their problem, help them solve their problems. This is one way of showing your care, but for sure, this is not the only way. There are many situations that a patient needs someone to listen to them, to listen to what they want to tell them. And it's not necessarily like for them to solve their problems for them. So maybe we can try that, listen. The third thing is the caretakers must learn this, how to take care of themselves. So this is a marathon, sometimes ultra marathon. So this is a chronic disease, it's an ultra marathon. So you cannot cure it overnight. So no one can run a marathon in 1 hour, for example. So sometimes you take a rest, you need to take a rest. You have to find a briefer before you can finish this 42.2 K of distance. The fourth thing is, and this is one of the most important, which we must remember, there's no way that we can be responsible for another person's moods, whether the other person is happy or not. Sometimes it's not for us to control, right? So as a caregiver, a lot of times what we have to learn is don't shoulder everything upon yourself. So fortunately, there are many resources for learning, because this is an advanced age for technology. You can find lots of information. For example, this interactive zone from Hong Kong, where you can learn a lot of information. And how about here in Canada, in BC, we have different information that our government can offer. For example, the iCON is one of the most important resources. So I hope that everyone can, with this information, lead a healthy, happy, and less worry life to face diabetes. Okay, thank you very much. Okay, thank you, Dr. Young. So actually, it looks like that diabetes is something that can affect your mental health well-being, because it creates a lot of stress, especially for those who live with you in the home, who care for you, who cook for you. All of these you know, there's some sort of stress to some extent or another. But for example, they don't like to take medications. They don't like this type of diet, or abstain from this or that. So it creates stress for everyone. So many thanks, Tigerson, Dr. Young, for sharing with us so much information about the mental stress. So if you are taking part for the first time, you have not been registered in our email list, you can scan this QR code to join our iCON mailing list. And in future, whatever activities we have, we will let you know in the first instance. I want to thank our community partners who are, well, there are very many, you can see. They are Vancouver Coastal Health, Fraser Coastal Health, CMHA, and South Vancouver Neighborhood House, Richmond Cares, Family Caregivers BC, UVic, Self-Management BC Institute on Aging and Lifelong Health, Vancouver Divisions of Family Practice, and Vancouver Public Library, as well as Villa Cathay Care Home and Richmond Care, Richmond Gives Caregiver Hub, Mosaic Caregiver BC. Thank you to all of you to help us promote and advertise this program to the public out there. And I also want to thank our media partners. They include Fairchild TV, Omni TV, Mingpao Daily News, and as well as Singtao Daily Group. And I also want to thank over the last 2 days, the hubs that were open have been open to the public. They include CLC Health Center, Jackson Lamb Adult Daycare Center, Day Center, South Vancouver's Neighborhood House and Villa Cafe Media Partners. Those are our media partners. You want to watch those presentations again, as well as other presentations, you can go to our www.iconproject.org website, as well as icon.support@ubc.ca to review those presentations.